Hello everyone, welcome to Health Australia Party Talk. Tonight I'm talking with Dr. Catherine Fyans, and she's a medical practitioner, 40 years of experience, so you get to see pretty much everything in 40 years. She works as a holistic or integrative medical practitioner, and that really means that mind-body link is very important to her. It's her main interest, understanding that our physical health is intrinsically linked with the way our mind works, with our consciousness, our subconscious mind, and our life experiences. So being an integrative practitioner, she sort of got a foot in both camps of healthcare and how to look after her patients, looking at the natural side and how the mind works, and looking at the medical paradigm as well. So we're going to look at a couple of camps, I guess we could call it tonight, about what's really happening in Australia, and particularly in Victoria, because that's where Catherine's from, about what's happening with this virus and what it all means. What does it mean to us? Are we getting the whole story on the coronavirus or COVID-19? What effects on our emotional and mental well-being does all of this have? And I think that's something that Catherine certainly can address, because it's not being addressed out there in the public at all. What's the reliability of the COVID tests? And what does the mass testing mean? And what do positive cases mean? How does this all fit in? And how do we live and work with this? Catherine's going to talk about the pros and cons of wearing a mask and looking at what the science is saying. And just what the implications of these current sanctions are. How does that affect people? And also the thing that I love bugs, as all my patients know. And what's the susceptibility to infection, rather than just focusing on barrier methods of this viral spread. So we've got quite a broad look at this COVID, the coronavirus, and how it's affecting us. And you know, as a health practitioner of also many years, I find it a little distressing that I can't say certain things, that we're not allowed to talk about certain things. And I think that in itself is a red flag to me. That tells me something's just not quite right here. And we really need to look deeper and see how we circumnavigate what's going on, so that we come out healthy, alive, and on top of it all. So with a great pleasure, I welcome Dr. Catherine Fyans. Welcome, Catherine. Thank you so much for joining us tonight.
Hi, Molly. My pleasure. Great to be here. Thank you.
Lovely. Shall we start off tonight? Let's start off by talking about the mass testing, because that's huge in Victoria at the moment.
Yeah.
And we'll work our way through the physical things to how this is affecting all of us, yes, emotionally and mentally. Yes. So what does this mass testing mean? Why are they doing it? And obviously, if you're testing lots and lots of people, your figures are going to go up and up and up. Exactly. So what does this actually mean?
Well, good question, Molly. Before I start, I'm just going to say that I'm not an epidemiologist. I'm not a virologist. I'm not an infectious diseases expert. I'm a person who happens to have been a medical practitioner for over 40 years, and I have a particular interest, as you said, in the mind-body connection. And I'm not representing the medical world in any of my statements or views. And I'm certainly not giving specific advice. I suggest any individual go to their own healthcare practitioners to get advice. So I just want to make that clear. I also want to acknowledge the people who have died and have suffered through COVID-19. I think it's important to state that there has been some real suffering involved with this, and you know, let's just acknowledge all of that right at the beginning. Okay. To be honest, I've got more questions than answers, and you know, the full picture of what's going on, who knows? I don't even think the experts know, some more than others, but a lot more questions than answers. So with the mass testing, and this is particularly prevalent in Victoria, as you know, we're in level 3 lockdown. This is our second round, and now the wearing of masks has been mandated. So essentially, we cannot leave home without a mask, okay? And we're up for a $200 fine if we do not wear a mask. And that's created all sorts of interesting scenarios, and maybe we'll come back to that. So right from the get-go, Molly, with this whole pandemic, look, I must say a lot of it just didn't make sense. I've been in practice for 40 years. I've seen epidemics come and go, and I know this is a pandemic. I hate to use that word, but unprecedented, and it's a so-called novel virus. But a lot of things we're doing now in 40 years, 46 if you include my medical school training, I've never come across before. So I'm intrigued, and you know, if there are experts out there, epidemiologists or infectious diseases, medical people, I would love their perspective. So with the mass testing in Victoria, and this is what I noticed when we had say about a 2-week interval between the first lockdown and the second lockdown. So things started to relax. Restaurants were opening. There was still the social distancing and all of that, but live, you know, gyms were opening. Life was getting a little bit back to normal. And I noticed, and maybe it happened before that, I'm not sure, I was overseas for some months earlier this year, there has been a very fervent push to have people tested. Now I'm talking about the general population. Now I've never come across that before, and I don't know if that's occurring in other states, but there's this big push for people to be tested. Now, for example, and I'm going to quote from the Australian Government Department of Health, yesterday, in the last 24 hours, and this was printed yesterday, there were 51,966 people tested in a 24-hour period. And out of that, there were 549 cases, okay? Now, all this time I've been saying, what's a case? What's a case? Because in my training, a case was a person with a disease. You know, in the old days, we used to say, oh, a case, you know, go and see the case in bed 25 in ward 6 or whatever. And a bit of a dehumanising term, but a case, in my mind, in my training, was someone with a disease. But these figures, like 549 cases, firstly, it's quite alarming because a lot of people, I think, assume, particularly if it's on the mainstream news, that a case is someone with a serious illness. So I looked into that. And a case is not necessarily someone with an illness, it's someone who has tested positive on a test. Now, my concern there is that it's fine to get figures, and there must be a rationale, of course, but it can give quite an alarming message to the general public, particularly when the picture fear is way up here, particularly in Victoria. So 549 cases doesn't mean 549 unwell people, but some people assume, oh, you know, if we're hearing it in dramatic tones on the nightly news, these are very unwell people. So it's putting out that, you know, atmosphere of alarm, and it's palpable down in Victoria, I can tell you. And so I just looked at some stats. Are you okay if I go through this?
Yeah, I'd like that. That's,
yeah,
because 51,500 positives, that's like about 1%, isn't it? But not 1% that are symptomatic.
Exactly. So that's the question, of course. And, you know, if public policy is made on those figures, that could be concerning. So anyway, I looked at the figures, and this is from yesterday, the Australian Government Department of Health. So total cases in Australia from the 22nd of January this year, so that's about 6 months ago, 14,935. Total number of deaths, 161 Australia-wide in 6 months. And, you know, as I said, we're very respectful of those people who've suffered in any way through this. But I'm just trying to give a perspective here. And then 259 people hospitalised. Now, I thought that was a typo when I first read that. So 259 people hospitalised, and we don't know if those people have comorbidities or not. We don't really know the context of that. And on it goes. Now, the intriguing thing also is that in New South Wales, where you live, and correct me if I'm wrong, and anyone can correct me if I'm wrong, but there were 17 cases yesterday. And compared to, quote cases, 549 cases in Victoria. Now, we've got similar population, similar lifestyle. And I don't think New South Wales is in complete lockdown to the extent we are. And I believe there's not the mandated wearing of masks at this stage.
Correct, yeah. The
now
lockdown isn't anything like Victoria. Well, there's really no lockdown here at the moment.
Okay. Lucky you. So I'm wondering why we have over 500 cases in Victoria and 17 in New South Wales. So what I would like to know, and I couldn't actually find the figures, is that cases per people tested or not? Is it, you know, how many people were tested in New South Wales to get 17 cases compared to Victoria? So I'm just a bit confused about these inconsistencies, and it raises quite a few questions about what is the case and really why are we doing it? It's not like, okay, you have a positive test, here's the cure. You know, the only thing in my mind is that people are further, you know, there are further sanctions are applied. And I'm wondering why the testing is done now, and it was done as soon as the lockdown was relaxed. And it's not done maybe after, maybe it will be, and there will be comparative figures after 6 weeks of lockdown. So that intrigues me and it confuses me. And I just wonder what it's all about. As I said, if someone can enlighten me, I'm more than happy to get some expert input that might be able to put some clarity onto this.
Yes, agree. I mean, it certainly doesn't make any sense, because in a pandemic, you isolate the ill or the infectious, not the well.
Well, yes, exactly. Well, that's exactly.
A lot of it's not making sense at all, is it? Yeah.
Well, no, it's not from, as I said, I'm not an epidemiologist, but I just wonder why there's this, and it's quite a fervent push of testing. And as I said, on the nightly news, and they'll break it down a bit, but the first thing people hear, and I don't watch much news, but if ever I turn on the TV, it's Victoria has so many cases, so many cases. And, you know, to be honest, I'm concerned about the effects of this fear, this heightened fear that has been going on for months now. This is not like a few weeks. It's been going on for months that people are subject to. And, you know, people have different susceptibilities of that, but we're not looking at the health sides of this level of fear that's been sustained for quite a long time now. And the question is longer.
Yes, it's, I think the repercussions of what is occurring is going to be far greater than anticipated or expected. Physically, I think, you know, to me, I look at this virus and go, it doesn't quite seem like a pandemic to me. To me, a pandemic, and again, I could be wrong, and this is just my perspective, a pandemic has the hospitals chockers. They're full. There's no room for anyone else.
Well, exactly.
And that's not happening.
Well, it's not happening.
And in New South Wales,
like New York.
Yes.
Yes.
Yeah.
Yeah, I agree, Molly.
Sorry?
Because, you know, we hear about, you know, the people working on the front line, the hospitals are jammed and there's so many respirators, et cetera, et cetera. When I looked at the figure, as I said, I thought, is this a typo? 259 total hospital, and maybe it is, 259 total hospitalised Australia-wide since the 22nd of January. I don't know if that's overwhelming hospitals.
Well, from 14,935 cases to 259 hospitalisations. Not even close to what the normal yearly influenza rates are.
Oh, not in this country.
No.
No, we know that, you know, roughly 900 people died of influenza in Australia last year. And it seems do we still have influenza? Are people testing for it? That's the other question I would have. We're very, very, very focused on the SARS-CoV-2 virus. And to make the distinction, the COVID-19 is the disease. SARS-CoV-2 is the virus. And that distinction's not always made, but there were about 900 deaths in Australia from influenza last year. And, you know, apart from obviously the people involved, we didn't bat an eyelid. So
Correct.
why is there this dramatic response to what's going on now in this country, I might add? Now, people will argue, they'll say, well, we've got less cases because of the lockdown, because of the masks. But the problem was always coming out of the lockdown. And I predicted this months ago, as did many other people, is that coming out of the lockdown would be a problem. And how often are we going back in and out, in and out, in and out of lockdown? And what else is going to be suggested if this continues? Now, I used to know of something called herd immunity. Somehow that hasn't come into the picture much. I'm reassured if I hear a lot of cases, but not a lot of unwell people, because to me that's saying most people are a little affected by this.
Exactly. Yeah, they've already got
maybe that's herd immunity, and exactly, or they're a little affected by this virus. And we know there's some talk of, you know, the antibodies not being sustained in people who have the illness, and that's a whole different argument. But when I heard those figures, I thought, well, so many cases, so many people are unwell. That's saying people are not affected. We know that there is a very susceptible group, so I'm not trying to diminish that some people are really susceptible to these things, as they are to influenza.
Correct, yes.
And other diseases. But, you know, there is a group, obviously, who are particularly vulnerable, and clearly they should be protected. But I guess the question begging is, should we turn our lives upside down, quite literally, and lock down pretty much the whole community and the ramifications from that? You know, people don't like to talk about that. We're so focused on the virus and the immediate threat of that this whole other side doesn't get much of a look in.
Yeah, that's quite true. That's true. And to say nothing of all the businesses that are closed, and they quite likely may never open again. It's hard to know.
Exactly.
But the financial stress that's coming from this is huge. It's
Yeah.
huge. And I believe too, correct me if I'm wrong, but I believe that in Victoria, there's a monetary incentive to get yourself tested. So if you're positive, you get quite a few dollars, I believe.
I can't give you the exact facts on that. I did see something about $300 being offered for testing under certain conditions, certain circumstances. I did actually try and look that up because it intrigued me. Why would people be offered money?
It doesn't make sense unless they have an agenda that requires bigger numbers to validate.
It begs the question. As I said, I've never known mass testing of the population before. So, as I said, if someone can enlighten me and there's a really good rationale, fantastic. I just don't see it. I don't see it.
Yes, agree. What about the reliability of this testing? What's your thought there?
Well, no test is perfect. Okay, every test has its positives and negatives. You know, potential false negatives and false positives, as does this test. And again, I was trying to do a bit of research, and it really depends on where you're looking for your research. So there is a well-known pathology company in this area, and they state that it has a very high, the PCR test which is looking for basically viral RNA. It has a very high specificity and a high sensitivity. And they just say it's very high. But then I've looked at other sources that say maybe not so high, or there are some potential issues with the test. Now, I'm not suggesting people don't be tested. I just think it's good to know both sides of the story. And, you know, as a doctor, my duty of care is to say there's always two sides of the story. There's always pros and cons. It's not a unilateral answer, unilateral problem, unilateral solution. Let's have a measured assessment of what's going on. So I'll just see if I can find this, Molly.
Yep. There's such a lot of conflicting information coming through, isn't there? That's what I've found. You can read one report and it'll say one thing, the next report says the opposite. So it's very, very difficult.
And what I'm finding is there's a study and then it's taken down and it's called false science. That's happening very rapidly, actually. It's like, that looks like a reputable study. No, it's gone.
Gone.
So there seems to be could I say, a wee bit of bias, you know, looking,
I think so. Yeah, I think you're right.
but interesting, and I think most people know this, so very reputable journal, The Lancet, they put out a study related to hydroxychloroquine in May, and this is well known, and it was found out that results were fabricated, and the study was taken down within a couple of weeks. So, you know, if The Lancet can have false science, then I guess anyone can. I'm not trying to knock that journal, not at all. It's a reputable journal, but, you know, I think all parties are subject to bias. And
it's interesting. I saw a video today with a group of frontline doctors in the US.
I saw it too, Molly.
Did you? And they were, some of them very, very passionate about using the hydroxychloroquine. They use it. They use it preventatively. I think she said 200 milligrams twice a week.
Correct.
And they use it to treat if you're fully got the disease. So with no deaths. No deaths. So I cannot understand why this information is hidden or retracted, because that video now is censored and it's gone off YouTube.
Yeah.
Yet these are frontline workers. These are people right there.
Exactly.
And they're saying they have an issue with not being able to get the information out to people. Everybody could have some preventative, cheap treatment.
Exactly.
And yet, why is this not being told to the public?
Yeah,
it's not right.
And I can't talk about hydroxychloroquine specifically, but I did see that. And this is, you know, a woman, a physician, a frontline physician. And I remember she saying that she had 350 patients and she, with COVID-19, and she treated them all with hydroxychloroquine. So this is, you know, an observational, anecdotal study, you could say, or her experience. And she claimed that none of them died and they all recovered quite well. Now, you know, she claimed that. So it's just going on our belief. But she had a group of doctors and they're all board certified. They seem to be a reasonable group. The intriguing thing that I heard with that is that it's very hard to prescribe hydroxychloroquine as a doctor, and it's blocked by pharmacists. And maybe in some states, I don't know if it's the US wide, I'm not sure what the situation is here, but it's certainly not recommended here. And you wonder why not? It's been around for many years, I think 60 odd years. It has been used extensively for a whole lot of other conditions. And does it have any possible adverse effects? Of course, every patient on the planet does. But overall, it's relatively safe. And if it's saving someone's lives, you would say that probably those potential side effects are fairly negligible. Now, the interesting contrast here is that there's been so many brakes put on that product. You know, we're hearing of other products being rolled out at a mass level that are being fast-tracked. And we're talking about potentially for billions of people worldwide, but that's okay. So I don't understand that.
There's something wrong with this picture, isn't it? When a proven drug that has worked for around 60 years. And in fact, I think, was it from 2005 when SARS hit? Was it 2005? They used it with success. Yeah. So now suddenly, because perhaps there's a different agenda at stake, and they're rushing out medications and vaccines that aren't tested, definitely aren't going to be fully tested because the time isn't there to do it. And yet that's acceptable. Well, it's just not acceptable to me. I want a better explanation.
Yes, I mean, there are inconsistencies, and I think it's fair to ask the question why, and I think we don't actually ask that often enough, certainly not in the medical world. Why are we doing this? Well, you know, why are these, it's acceptable there, but it's not acceptable there. Why is this happening?
Yeah, there's something wrong with this picture. That's for sure.
Look, I must say right from the beginning, Molly, you know, we certainly look for the research as best we can, and we know it's very conflicting. And it's a minefield trying to get all the data because it changes rapidly. This whole scenario is changing quite rapidly, but right from the get-go, like my gestalt. And I'm sorry, but you know, that's to me, as you know, it's reliable. In addition to the scientific backup, let's use both.
Yes.
My gut, let's say, said, there's something very strange about this. Very strange. Now, maybe other doctors don't have that opinion. Their experience might be different. So, oh no, it's all fine. But it just didn't make sense, and it still doesn't make sense.
Yeah, agree. And I find it interesting that, well, I guess because we're starting to see all these doctors from America speaking out, and some very vocally.
Yes.
And yet nobody here is saying boo, and they must be having the same experiences. I can't imagine that it's different here.
Look, I've found that quite intriguing too. As I mentioned, I was overseas for some months, so I've come back in the middle of this, so to speak. But, you know, I've been waiting. It's like, well, let's see what this medical group's going to say. Let's see what this medical group's going to say. And I'm still waiting. And it's like, where are the voices? Maybe they're there and I'm not hearing them. That's possible, but I'm not hearing them. There are some well-known nutritional doctors who are promoting things like vitamin D and, you know, good nutritional, simple things that can be very, very, very helpful for our immune systems. So there are some people out there for sure. But generally, I'm not hearing a lot, apart from, you know, the main med.
Yeah, it's very quiet, isn't it? Catherine, I've just got a question from someone, and they've said, with the COVID-19 testing, why are the tests so invasive and painful? You know, the probe they have, they push it right into the back of the nose. What's your thought on that? Okay,
so with the testing, you know, the same swab tests the back of the pharynx and also the nasopharynx, which is up the nose, because the nasopharynx is tucked right behind the upper part of the nose. Tests of the nasopharynx have been around. That's nothing particularly new. You know, the idea would be to get an adequate sample from that part of the nose because it would be harbouring more viral particles. That's the only rationale I can give.
Okay.
Yeah.
Okay.
But an uncomfortable test, for sure. And then there's the blood test, the serology test, which is more of a retrospective test. It's checking for antibodies. So it's more someone's had the disease.
So would that be more accurate to see if you've got antibodies, so you've had it, whereas with the nasal swabs, there's so many false positives and false negatives. Would the blood test not be more accurate?
Look, I can't actually give you figures on that, to be honest, but every test has potential false positives and negatives because they can cross-react too. And there is some data about some tests cross-reacting with coronaviruses from common colds, testing positive because of cross-reacting with other similar viruses. There's always an element of imperfection in any test. They can be good, but not perfect. So that's That's the only rational explanation I can give you about the nasopharyngeal swab. But a lot of people do find it very invasive and
very uncomfortable, I believe.
Yeah, exactly.
What about, Catherine, what about the pros and cons of wearing your masks? Now that it's mandatory in Victoria, you can't go anywhere without one.
Okay.
What's the good, what's the bad?
It's a total minefield to talk about that, but I will. So in Victoria, or at least in parts of Victoria, not all of Victoria, Melbourne and some other areas, it's mandated, okay? So I'm not telling anyone to wear or not wear masks. You know, the sanctions are there, but I'm just giving some general information because there are always two sides to the story. So the main idea from wearing the mask, as far as I know, is that people are not shedding the virus for others to get infected, okay? Now, we know traditionally masks are used in a clinical setting, you know, in the surgical setting, so that the secretions from a surgeon's upper respiratory tract are not falling into the open cavity in surgery. So that was mainly why they came about, but also some protective reason too for healthcare workers. So there's been a lot of debate, and I have looked at a lot of studies, Molly, and a lot of them have been pulled down, and I'm just seeing a lot of conflicting advice, to be honest. But when you really look into it, firstly, there's a lot of inconsistency of the type of mask people wear. So, you know, the most accurate mask, as far as I know, is the N95, and I think that's meant to have 95% accuracy. Maybe that's why it's called N95, in preventing droplet spread that contain the virus. But as for the rest, there's a great deal of inconsistency in the type of masks, and therefore they're effective. But the surgical masks are only designed for single use. They weren't designed to be using the same mask day after day. And with the, say, cloth masks, they do advise that you have 3 or 4 layers of material, but they're meant to be washed in a very frequently, because, you know, potential concern is that if they're moist and wet, they can harbour the viruses and bacteria. They can become a nice little breeding site. And it doesn't take a lot of, you can see how that can be the case. So the advice is to wash them very frequently. Now, I guess people do their best, but it's not always very practical. And I'll just give you a story from my life. I was going for a walk the other day and I trekked through the country, and I had a mask on, but I think I was drinking a cup of coffee and I took it down to have a sip or whatever, but it was momentarily, off my nose. And a jogger ran by. Now, he had a bandana around his nose. Joggers don't have to wear masks when they're jogging here, but he did. It wasn't a mask, bandana, but over his nose. And clearly it was moist and wet and sweaty. And he ran by me and yelled some abuse at me because I had my mask off my nose momentarily. Hope they don't come and get me for that. No joke aside, it's a bit like that here. So, you know, the practicality of, you know, the inconsistency of them, it doesn't seem to matter as long as you have something over here, okay?
But it's
so
okay
it's become a bit
if
of a war
joggers
down
don't wear them.
It's okay if joggers don't wear them. I think cyclists, if you're doing strenuous exercise. But the point being that what he was wearing was totally ineffective. I knew that.
Yeah.
But we're getting this sort of atmosphere. There's a real mask war going on down here, and it's unpleasant. It is very unpleasant, because pretty much people who are very pro-mask, and that's fine. You know, as I said, it's mandated here. They're not necessarily appreciative of people who might say, well, you know, there's two sides to the story. There's pros and cons. Let's discuss it. And a lot of us are called selfish if we even open that discussion, because people are seeing that as a direct threat. And it's getting beyond that. You know, there are things alluding to you're a mass murderer if you're not wearing a mask. You're a direct threat. Not blaming these people. I think because of the heightened, you know, this mass media fear, you know, pumping out pretty much 24/7. People are in survival mode. And when we're in survival mode, which is meant to be a short-term, not a long-term thing, and I'm not saying everyone is, clearly they're not, but some people are, the focus is very, very narrow, and people put their focus on what, you know, ensure their survival. And right now, for a lot of people, it's masks. If you're not wearing a mask, you're a threat to me. And it, you know, at a primal level, for some people, it's you're potentially killing me if you're not wearing a mask. And there's a bit of a mob mentality out there. Yeah, it's a minority, of course. Most people are really tolerant, and we have to wear masks anyway. But there is an unpleasant aspect of it. And it concerns me what this has done to our community, because there's a real division happening. And the other thing that concerns me, Molly, and you've been a natural health therapist, probably will be able to relate to this. It's a very unilateral argument that our protection from a virus is just due to physical barriers, masks, perspex, gel, lockdown. Now, to me, that's a very small aspect of, you know, protecting us from an infection or an illness. And it's giving a locus of control out there. Like, okay, something out there can get me, therefore I have to have something out there to protect me. Now, I don't see that in my own health at all. I actually, and I'm not suggesting one adopt my views, and this is related to my mind-body studies. I don't believe anyone will give me a virus. I believe that if I have a certain level of susceptibility, that virus is going to find me. It's not someone giving it to me. And if I don't have that susceptibility, I can be surrounded and I'm not going to get it. So I'm concerned about there being a very unilateral sort of focus on this. And related to that, you know, things that we can easily do and very cost effectively do to you know, help our immune systems. Simple as vitamin D, zinc, these are well established. Adequate sleep and stress reduction. All of that goes a long way to make us less susceptible to getting something. Now, I'm not saying barrier methods are not helpful, but if we give, you know, we're giving ourselves a false sense of security in saying we just kind of block out the virus and, you know, we're fine. Now, this has been going on for months now. And the question is, for how much longer? And I don't even want to think about the answer, to be honest. And we've had a long time to be looking at other aspects of our health. Why is not the nightly news telling us about things that we can do to boost our immune system?
Exactly. Yeah. It's like there's just a lockdown on information as well as locking down people.
But I don't separate health from life. That to me is a total misconception. You know, our collective understanding is health's there, life's there. To me, it's all connected always. Mind, body's connected, and that's the way I see health. And you know, to separate them makes no sense at all. So our levels of stress are a big factor regarding whether we're susceptible to an infection or not in our immune systems. And particularly if we're in a heightened state of fear, and not everyone is, but some people are. We know of some people who've been in, you know, extreme anxiety about this for a long, long time. We know people who've virtually not left their houses for several months. So some people are very anxious. Now, we're designed for short-term stress, not long-term stress. And it directly affects our immune system if we're in that heightened level of stress. So, you know, we have to look at that side as well. If we want a balanced picture of what's going on, let's look at that and you know, the psychological, emotional and social implications of the lockdowns on our health. And, you know, the people who've lost their jobs, the people who are, you know, heading into poverty, people who've lost their business.
Yes, the ramifications are going to be extreme, I believe.
People who can't go to church to worship, we can't gather. We are communal creatures. It goes against our very nature to be separated. Now, a lot of people have families and they might have, you know, a nice home with a garden and a yard. Not everyone lives like that. Some people live alone in a small apartment. And, you know, that situation is quite dire for a lot of them. And they count. They count. It's not about, will the virus get me? it's like they also count, you know, the depression, the anxiety, the suicides. And sadly, and I weren't directly involved with these people, but I heard of 2 suicides in teenagers recently, like in very recent weeks. And it mightn't be related to COVID, might have nothing to do with it, but these figures don't make the headlines. It's all about the virus. And how can I protect from the virus? And it's creating a division in my community that is very uncomfortable, you know. So we've got to look at that whole picture. We are communal creatures. We are meant to be near people. There's a hormone called oxytocin. And we know it as a love hormone, but it has many other functions. But it's related to calming the stress, and it's anti-inflammatory, and it's an antioxidant. And if we're not getting that human contact, particularly people who are living alone, that level of that hormone, which actually enhances their immune system, is being diminished. We don't look at that. It doesn't make the nighttime news, because people are looking, when they're in survival mode, what is the thing in front of me that's going to affect me? The virus. You're not wearing a mask. You are a direct threat to me. And I'm not blaming these people, because that's the way our, you know, defense system is designed.
Yeah,
but
it keeps us safe.
It's such an imbalanced picture. And, you know, the way I see it, there's 2 main camps of people related to how they're reacting to this. And there's a whole spectrum, of course. But at one end, it's survival at any cost. I will do anything. I will give up any freedom if you can ensure the authorities, my survival. I don't care what it is. And if anyone interferes with that,
Catherine?
freedom's important to me.
Sorry, we seem to have lost contact there for a minute. It froze. You must have been saying something important. It froze.
Yeah.
I've just had a question come in.
Sure.
Are you able to talk about germ theory and terrain theory?
Yeah.
Please. Yeah.
Sure. Okay. Whoever put that in, thank you. All right. So Western medicine is based on germ theory. And germ theory is a germ can get me, it will cause a disease. Something comes into a body. We haven't even talked about the microbiome, by the way. It would be nice to mention that, because it's a whole another, it's a very relevant. So germ theory is something from the outside will come into my body, or it might be something in my body that turns pathogenic and will cause the illness. Terrain theory is, well, that will only happen if there's a certain level of susceptibility within my system.
Exactly. So it comes back to, well, the microbiome, but also making sure you've got good levels of vitamin C, vitamin D, zinc, which we know supports the immune system.
Yeah, totally. And these are very accessible, simple things that can be very helpful. But it occurs, our immune system is, we're very focused on the physical. I don't see things in just the physical. Our immune system is body, but it's also mind, and, you know, if I dare say, it's spirit as well. So when we're looking at our internal milieu, we're looking at body, mind, and spirit. Because, you know, having an interest in mind-body medicine, I realise how these things work. So terrain theory is, let's get this right so that we are less susceptible to that. And then, you know, there's a further question, which maybe I shouldn't mention, but I will, that is the germ actually causing the illness, or is it coming in to help mop up the damage? Now, that's a very controversial statement. And there have been people who've been excommunicated and seriously.
Yeah.
Yeah. Even Louis Pasteur allegedly said in his deathbed,
it wasn't the germ, it was the terrain. Yeah. Sorry, it keeps breaking up. I'm not sure why it's doing this.
Well, the whole of Western medicine is very much based on the germ theory.
Yes.
And we wouldn't be too happy to question that for a number of reasons. But, why not? It's good to question things, because a lot of what was held sacrosanct in science was later proven to be completely incorrect. So why can't we do that now? I'm just saying it's
Absolutely.
good to think
Yeah.
and look at pros and cons. And the other thing is, we also have a psychological susceptibility. I had I'm normally very fit and healthy, but I had a respiratory illness, quite a nasty one, a couple of years ago. And I know in my system, I had a certain type and a certain level of stress that made me vulnerable to getting that to stop me in my tracks. Now, this is not a commonly held idea, and a lot of people would think, what is she talking about?
Yeah.
Yes.
Yes.
For some people. And, the other thing about illness, and of course we want people to be, as healthy as they can be and live as long and productive life as they can, but illness is not always the enemy. It is sometimes the teacher. We don't look at it like that.
No, we don't. We try to avoid it at all costs, and yet often it's the healer. The bug or the illness is a way the body starts to heal. And it's not a common way that medicine looks at things. Yes,
I'm not saying we need to have that or have to have that, but it's sometimes the way. And in my situation, I had some cues. I was going down a track that wasn't, in alignment, let's say. And, I know in retrospect, this was to stop me in my tracks. And I had to go through a period of convalescence. And, I learned a lot through that period. It was a great learning time for me, difficult though it was. So I'm not saying people have to be unwell to learn, not at all, but I'm saying there is a different side to it. And, there's this whole emphasis on we can never get ill. We have to, we will sacrifice anything to ensure we don't get ill and that we certainly don't die. And I don't think life works that way, and I think it's a total misconception, and no one can ensure someone else's safety. And on that note, if we were so concerned, why do we drive a car? Why do people smoke? Why are cigarettes still being sold? And this is not to have a go at smokers, not at all. But, there are inconsistencies.
Yes, absolutely. If it's all about health and keeping people healthy, we have to have a broader look at what's going on, don't we?
Yes, I mean, if we're just focused on this one area and it's all about the virus, and don't look at the whole, spectrum of health and wellness, it's very unbalanced. And we know a lot of people are not going to their doctors to have their normal tests and checks because they're too scared, a lot of them. And a lot of doctors are not in their offices anyway and can't properly examine them.
Yeah, and a lot of them are doing Zoom consults.
Yeah, I'm very old school. I actually like to have the patient in front of me.
Well, on that note, where do you practice? Someone's asked where do you practice?
It's in flux at the moment. As I said, I came back from overseas and I'm changing, so it's probably best I don't advertise myself. Thank you for the question.
Well, we could always check out your webpage. So
yeah,
you do have a webpage.
Exactly.
Okay, so I guess what I'm hearing is that no, we're not being told everything that we can do to help ourselves, only a few of what external things that we feel will protect us, but in fact, probably isn't protecting us very well at all. And the things that really will sustain our immune system and our health is not being mentioned.
No, it's also intriguing on that note. I'm not allowed to sit on the beach for 10 minutes to get some sun for my vitamin D. And not that we want to in winter, I might add. But that's just a simple thing that is very helpful. Now, for some reason, that's not allowed in Victoria anyway right now. We can't actually sunbake. I think we can social distance on a beach as much as we can in Bunnings or the liquor store.
The essentials.
So, you know, there are those inconsistencies.
Yes.
And, you know, Molly, I also think quality of life is important. It's not just about, you know, we're not allowed to say that, but quality of life is important. And as I was saying before, there's two camps. I will do anything for my survival. Lock me up, take this freedom, take that. And some people are happy to live like that. The other group at the other end of the spectrum, and there's a whole lot of people in between, saying, no, I will do anything for my freedom. This is what the mask issue is about. It's not.
It's breaking up again, Catherine.
Interesting that it is when I talk about this. I did before.
I know. It's funny how things break up when you're saying something pretty amazing. Okay, so to finish up, Catherine, how important, and I think it's important, but I'd really like your perspective on it, is the integration of what we physically do with what we think about. So how do we overcome all the fear? Because people are enormously fearful. As you say, they'll do anything to not feel that fear.
Yeah, and anxiety is very uncomfortable. That's not a pleasant state to be in. And we know it lowers our immune system. We're not meant to be in that sustained fear for months. We're not designed that way. You know, we're also very resilient. So we can, I don't want people to be afraid of the fear, if you know what I mean. We can bounce back, given the right circumstances.
Absolutely. So what's a couple of suggestions that you could give to people
What can I suggest that we can actually do? There's a nerve called the vagal nerve, and we haven't talked much about the autonomic nervous system, but we know that the sympathetic side of the system puts us into fight or flight to cope with challenges. The other side of the autonomic nervous system, the parasympathetic nervous system, is for rest, repair, recovery, and maintenance of our organs and physiological systems, i.e. we need it for health, to keep the body in homeostasis. So what we're finding now is a real imbalance of sympathetic nervous system. For many people, not all, overdrive, and the parasympathetic is underactive. We need that to come up to maintain some balance and, you know, for our system, for the sake of homeostasis. And a big part of the parasympathetic nervous system is the vagal nerve. And we hear a lot about the vagal nerve now. And there are methods to help calm or let's say tone the vagal nerve, which will help to calm the system and put it into balance. And also help our immune system. So that includes things like, the problem here, Molly, is a lot of the things we would normally do to kind of calm down, we can't do. We can't go to the movies. We can't have dinner with family. We can't go to cafes with friends. We have to wear a mask here if we go outside. But the things we can do, you know, things like meditation, mindfulness, definitely.
Okay, we've frozen again. So meditate.
Yes. Yeah. Meditation, mindfulness.
Mindfulness. Yep. And positive thinking. You know, maybe think about something other than the virus for a while.
Yeah, I would say turn off the mainstream media.
Yep, agree.
That would be a because it's alarming. I don't watch it, but if I accidentally have turned onto it, it's like, oh my goodness, you know, 500 and something more cases in Victoria. And then I break it down to think, oh, it's not so bad.
Yeah.
And maybe we need to hear the good news that most people recover from this very well. Hardly affects young people. There will always be exceptions to the rule. Someone will always know a young person, but it very, very little affects young people, but it's turned their lives around. And I'm very concerned about that group, particularly the teenagers. They're meant to be out with their friends, socialising.
Yes.
So we need to hear good news. You know, the crises have a meaning. Crises are to break down old ways of being and old structures that do not serve us well. And it's messy and it's chaotic, but there is the potential for a better new way to come out of it. And I hope and pray that will be the case. So we need to find some meaning from our experiences. Many people have heard of Viktor Frankl, who, he lived through the Holocaust and he was in a ghetto, but he got through it. He found some meaning. What is the meaning? How can we increase our wisdom, our compassion, our empathy, gratitude? That is one of the good things to calm us down and increase the tone of the vagal nerve and the parasympathetic system. Gratitude, no matter how dire things are, there's always something good. There's always a silver lining, something good that comes out of these situations. Crises have a function. They're deeply uncomfortable, but there's always the potential for good things. We're going through a massive dark night of the soul, collectively and individually, and it's a big deal. It's a big deal. This is hard.
Yes, it's very hard. It is very hard.
We'll find ways to bond with people. Like, if we can't see them, that is definitely preferred. But, get onto some meetup groups. Say, hey, we need human contact. That's essential. Reading
inspirational books. Is that what you're going to say, Catherine? It's frozen again.
Inspirational literature.
Yes.
And look at what humanity has been through. Like, this is on a much more global scale, but people have been through huge challenges and dramas, and we want that to make us more courageous, not more fear-based and constricted and separated and fighting each other. Even during wars, people on the same side, they bonded together. Depression actually went down in many of them, and this is not happening here. It's quite the opposite, isn't it? Really, what's happening?
There's more division and almost hatred building.
Yeah, so we'll only survive this if we come together as a community. And part of my concern about the isolation, separation is it's making that hard.
Okay, so on that note, I thank you for joining us. I think some really good suggestions, as in the positive things, getting to a point where people actually perhaps question what's happening and look at a bit of a broader picture, and how they can make things work for them. I guess. I don't know what else you can do in a situation where everyone's locked down, except question it. Question, because this is not making sense.
It's our human right to question everything. And I believe it's everyone's right, any informed, capable adult. You have to choose what is right for them and what they put in their own bodies. That is a basic human right. We have very easily handed over for the illusion of safety. No one can promise us that. We can only get that. But that's really saying, I'll give up any freedom so you can save me with whatever. It's a total illusion.
It is an illusion, and it's an easy out, because it means you're not responsible. Somebody else is going to fix it for you.
Totally. And
we have to change that. We have to change that mentality.
Oh, totally. Well, a lot of Western medicine is based on it. It comes back to the old problem, reaction, solution model. You have a problem, or you're going to get a problem, or your loved ones will. Reaction. Sometimes anger, mainly fear. And solution is, we will give you something to get rid of the problem. I think it's good to look at other models, and I think it's good to question things. Why not?
Well, isn't that the basis of science? Question, learn, change where necessary.
Exactly. Well, change is happening. We're in it.
It certainly is. It certainly is.
And as I say, we need to be very careful of the new normal we're going to agree to, because there might be no turn.
Yes, I agree with you there. It's if we don't stand up now and ask the whys and get some honest answers, then tomorrow might not be as pretty as yesterday was.
Yeah, exactly.
All right. Catherine, on that note, we'll wrap this up, and I thank you very, very much for talking with us tonight.
My pleasure. Thank you.
I've learned a lot, and I thank you for that. And I hope everyone out there has gained as much as I have. So thank you. Thank you very much for joining us, Catherine.
It's been my pleasure.
Thank you. Good night.
Okay, good. Bye-bye.
Good night, everyone. Thank you for joining us, and God bless, and safe journey for those in Victoria.
Yeah, we're doing it tough.
Yeah, I'll say it's very difficult.
It is. Thank you. Good night.
Good night. Good night.